Welcome to the New Hire University Benefits Overview. Most of the information that will be discussed today is administered by the University Benefits Office and can be found on our website at hr.uiowa.edu/benefits. Information including websites, phone numbers, and email addresses for most of this information discussed today can be found on page 27 of the 2020 Benefits Guide. If you still have questions, you are welcome to email us at benefits@uiowa.edu or give us a call. Our office hours are Monday, 9 a.m. to 5 p.m., and Tuesday through Friday, 8 a.m. to 5 p.m. The pie chart on this slide shows you a picture of your benefit offerings here at the university. The yellow piece represents the benefits that have 100% UI contribution, which includes group life insurance 2 times your salary, long-term disability, vacation and sick time, family and medical leave, workers' compensation, and more. Black represents the benefits that have some UI contribution. You do not have to sign up for health or dental insurance. However, your participation in retirement plan is mandatory. You and the university will both contribute to your retirement plan. And the gray piece represents the voluntary benefits with no UI contribution. But you have the opportunity to sign up for any of these if you wish, such as flexible spending accounts, AD&D insurance, vision insurance, and more. We will talk about these benefits more as we move through the presentation. Three important features of today's presentation with regards to your benefits are eligibility, effective dates, and enrollment deadlines. Those employees who have a regular benefit-eligible position with an appointment of 50% or greater are eligible for benefits. The effective date of insurance is the first of the month following your employment start date. The deadline for enrolling in your benefit programs is 30 days for the insurance plans and 60 days for the retirement plans. Information about eligibility and effective dates can be found on page 8 of your guide. Who can be covered on your insurance plans? A few examples of eligible dependents are a legal spouse, a common law spouse, a domestic partner or of the same or opposite sex, and dependent children. Children can be covered on your plan until the end of the calendar year in which they turn 26, or longer as long as you provide adequate documentation showing they are a full-time student or physically or mentally unable to provide self-care. Please note that both a common law spouse and a domestic partner require an affidavit to be on file with the Benefits Office. Affidavits are available on our website under the Forms pages. More information about eligible dependents can be found on page 4 in your enrollment guide. Dependent eligibility verification. If you plan to add dependents to your insurance plans, you will be required to submit documentation to University Benefits in order to verify their eligibility within 4 weeks from the time you added them. Common documentation for the following dependents. If adding your spouse, 2 documents are required: a marriage certificate and the first page of last year's tax filing. If you will be adding dependent children under the age of 26, you will need to submit their birth certificate or the court order that names you as their legal guardian. If you will be adding dependents over age 26, you will need to submit their birth certificate as well as a class schedule that shows they are currently enrolled in school. After you complete your enrollment and you have added dependents, within 24 to 48 hours, you should receive an email from our office instructing you on how and where to submit your verification documents. If your documentation is not received by the 4-week deadline, Your unverified dependents will be removed from coverage and cannot be added without a qualifying event. Double spouse credit is a credit that is available to those employees who have a spouse or domestic partner who also works for the university, and they will elect family health and dental coverage to cover children. In the case of double spouse credit, one employee carries family coverage at no or little out-of-pocket cost. The other employee only has the option to select the life insurance plans. There is no cost benefit when only employee and spouse coverage is needed. In that case, each employee would choose a single plan. More information on the double spouse credit can be found on page 5 in the guidebook. University credits. All employees in a regular benefit eligible position will receive university credits. Credits are used to lower the out-of-pocket costs for eligible benefit options. Credits will also always be applied to your before tax premium deductions first, if you have any. They are shown in the earnings section of the paycheck and are applied to offset your before tax deductions. Leftover credits are defaulted into a healthcare flexible spending account. Employees may select for remaining credits to go into a dependent care spending account during the enrollment process. To help offset insurance costs and flexibility in making your decisions, the university offers all eligible employees $90 in general credits every month. You also have the option to receive shared savings credits on top of your $90 general credit. If you choose to waive dental insurance because you have it somewhere else, you may receive an additional $25 in credits. If you have salary over $25,000 and you elect only $50,000 coverage in group life insurance, you will receive another $40 in shared savings credits. These credits are to be used towards your benefit premiums to help lower the out-of-pocket costs. They will not be added to your monthly salary. Per IRS guidelines, if an employee waives the university's health insurance, $500 is the maximum amount of credits they can receive for the year if said employee does not have another plan that provides the minimum value coverage. More information about the minimum value coverage can be found on the benefits website. Employees are responsible to notify the benefits office immediately if enrollment status and other health insurance changes. Choosing your benefits. We will now discuss all of the options in more detail. When you make your selections for your benefits, you will have coverage options to choose from. For the health and dental coverage, you can opt to waive your insurance coverage, meaning you will have no coverage, or you can select employee-only coverage, employee plus spouse or domestic partner, employee plus children, employee plus family coverage, which includes you, your spouse or domestic partner, and your children, or double spouse family when both spouses or partners work at the university and are covering children. Before we move on, I wanted to bring up a few basic insurance terms you can review. You can review these more in depth on page 10 in your guide. Premium, the amount you pay monthly for insurance. Deductible, the amount you owe for covered health care services before your health plans begin to pay. Copay, a fixed dollar amount you pay for a covered service, typically due at the time of the service is provided. Coinsurance, a set percentage that you pay for covered services, usually billed by the provider after the service. Out-of-pocket maximum, the max amount you pay for covered services during a plan year. The university's health insurance plans are administered by Wellmark Blue Cross and Blue Shield of Iowa. Benefit eligible employees can choose between two health plans, UI Select and UI Choice. More information as well as a side-by-side comparison of both plans can be found in your guide on page 8 through 11. It is important to know the difference between participating and non-participating providers. A participating provider is a provider who accepts Blue Cross Blue Shield payment arrangements. Receiving treatment from a participating provider results in a lower out-of-pocket cost for you. A non-participating provider is a provider who does not accept Blue Cross Blue Shield payment arrangements. This means they are not contracted to the amount they can charge for the services provided and could potentially balance bill patients. To search for providers, visit wellmark.com and choose the Find a Provider link. You do not have to select a level of coverage. You can see any provider you choose. However, the participation level of the provider in the network will determine your benefit level or what you pay. Level 1 are those providers with UI healthcare. This includes the clinics at UIHC, the Carver College of Medicine, Pediatric Associates of UI Children's Hospital, Washington County Hospital and Clinics, and the Iowa Clinic PC. Level 2 are those Blue Choice Network providers who are not included in Level 1. Locally, this would include Mercy of Iowa City. Level 3 are providers not in Levels 1 or 2, who may or may not participate in Blue Cross Blue Shield plans. There are many convenient UI healthcare locations: UIHC, North Liberty, Muscatine, River Crossing, and more, including quick cares and urgent cares. You may find all locations listed on their website at uihc.org/locations. As I mentioned earlier, you have two health plans to choose from: UI Select and UI Choice. UI Select is designed for employees who value high quality coverage with lower monthly premiums. If they use their coverage, they would pay a higher out-of-pocket cost for medical services. UI Select is a traditional deductible plan and only covers Level 1 and Level 2 providers, meaning it only covers medical providers in Iowa. Coverage outside of Iowa is not covered except in emergencies or with doctor on demand. Our other plan, UI Choice, is a high quality plan with extensive coverage inside and outside of Iowa. Premiums for UI Choice are higher than UI Select, but the out-of-pocket costs for medical services are lower. There is only a deductible for inpatient hospital stays, and UI Choice covers all three provider levels. Coverage is provided nationwide. This slide shows you the 2020 monthly premium rates for UI Select and UI Choice. UI Select has the free option for employee-only coverage and double spouse family coverage, where UI Choice has a $34 monthly premium for employee-only and $87 for double spouse family coverage. At a quick glance, you can see that UI Select rates are lower than UI Choice rates. However, the out-of-pocket costs are lower for UI Choice if you use the plan. The next few slides will compare the plan provisions of each. I am going to point out some of the biggest differences, and you may review closer on page 9 in your guide. Here, you can see that UI Select has 2 levels and UI Choice has 3. UI Select has annual deductibles: $400 single and $800 family under Level 1, and $800 single and $1,600 family under Level 2. In comparison, UI Choice does not have annual deductibles. However, if you had an inpatient stay in a hospital, you would see that each level has a deductible plus coinsurance. Annual out-of-pocket maximums for UI Select are $2,000 for single and $3,400 for family under Level 1, and $3,000 for single and $6,000 for family under Level 2. UI Choice has the same out-of-pocket max for all three levels, with $1,700 single and $3,400 family. If you were to see a non-participating provider, there is a separate out-of-pocket maximum of $2,000 for single and $4,000 for family. Preventive care is covered under both plans, no matter what level. Doc on Demand is free for both plans, and both plans have a $5 copay for UI Quick Cares. You start seeing differences in copays here at Urgent Care. Both Level 1 providers for urgent care will be a $10 copay. However, UI Select Level 2 is a $35 copay and $25 copay for UI Choice. With office visits, UI Select is broken up by primary care versus specialist care, where UI Choice has the same copay no matter what type of office visit. ER visits with both plans, no matter what level, both have a $100 copay followed by a 10% coinsurance. Mental health visits are free for UI Choice for levels 1 and 2, and UI Select has a $10 copay for both levels. There are two main differences between the pharmacy benefits of UI Select and UI Choice. UI Select uses the Blue RX Value Plus formulary list, and UI Choice uses a Blue RX Complete formulary. There are some drugs that are not covered under the UI Select formulary list, so please review your prescriptions to make sure you will be covered if you choose to enroll in UI Select. The second difference is that UI Choice covers all four tiers, where UI Select only covers the first three. It is possible that if you are taking a Tier 4 drug and you enroll in UI Select, you could potentially find a generic version that would fall in the first three tiers. Other available services for care. Doctor on Demand is telemedicine for minor illnesses like sinus infections, strep throat, rashes, etc. You can obtain care from a licensed healthcare professional using a computer with a webcam or a smartphone with video capabilities. You visit with the physician face to face through the video, and prescriptions, if necessary, can be digitally sent to the pharmacy for pickup. This service is free to those covered by UI Choice and UI Select. You would use your 8-digit university ID number and your UI Choice or UI Select member number to request care. Mental health visits are not covered services through Doc on Demand. There is also a health access line available. This service is also free to UI Choice and UI Select members. This number is available 24 hours a day, 7 days a week. You may call and speak to a nurse or on-call physician to obtain advice. UI Quick Cares. These are clinics located in the Iowa City, Coralville, and North Liberty area where patients can walk in, no appointment necessary. Patients must be at least 6 months old, and the clinics are open from Monday through Friday from 7 a.m. to 7 p.m. and Saturday and Sunday from 7 a.m. to 5 p.m. UI Urgent Care is your alternative to the ER. They are able to do a few more services than what can be done at Quick Care, such as IVs, x-rays, and stitches. To save time in the waiting room, you can reserve your spot before you go. Head online and find the location you will be attending and reserve your spot now. Our dental insurance plan, Dental 2, is administered by Delta Dental of Iowa. Like the health insurance plan, you may visit any provider you choose. There is always a cost advantage to using a participating provider. Also, like the health plan, the dental plan has 3 levels. The provider's level of participation with Delta Dental determines your benefit. Tier 1 is the Preferred Provider Organization or PPO network. Tier 2 is the Premier Network. This level would include all Delta Dental providers who are not in the PPO network. Tier 3 providers are those providers who are not part of the Delta Dental network. You may see these providers, but note that they are not contracted for the amount they can charge for services, and they can balance bill you. You may find a list of providers through the Delta Dental of Iowa website. These are the 2020 monthly premiums for Dental 2. The university pays 100% of a single or double spouse family coverage and 80% of the costs for the other family statuses. More information on the dental plan can be found on page 12 in your guide. This slide shows a quick summary of the dental plan benefits. The dental plan covers preventative maintenance care such as routine exams, teeth cleanings, diagnostic services at 100% with no deductible and no coinsurance. There are 2 of these visits allowed per calendar year. The plan also covers routine and restorative care such as cavity fillings, emergency pain relief, anesthesia, and tooth extractions with no deductible and coinsurance for these services at $0 cost for the PPO level, 20% at the Premier level, and 20% at the non-participating level. High-cost restorations such as root canals, crowns, bridges, dentures, implants are covered at coinsurance of 10% for PPOs, 20% for Premier providers, and 20% for non-participating. On this dental plan, orthodontia care does not have an age limit. Anyone covered on the plan can have braces. Commonly, plans have a lifetime maximum for orthodontia benefit. There is no lifetime maximum on this benefit with the Dental 2 plan. The plan covers braces at 50% per member up to the maximum annual benefit of $2,000 per year. The dental plan features include a maximum annual benefit of $2,000 per member. The plan also has a carryover feature. This means you can carry over to the next year the portion of your $2,000 benefit that is not used. The criteria for carryover is you must be covered for the full year and you have to have had at least one claim in the year. If you meet the criteria, you could carry over up to $2,000 for a benefit of up to $4,000 in 1 year. In addition to the benefits of the dental insurance plan, the College of Dentistry offers an incentive program. If you have a treatment that is academically beneficial to the residents at the College of Dentistry, you may be eligible for up to $2,000 per year toward your out-of-pocket costs through this program. Treatment is provided by third and fourth year dentistry residents supervised by the faculty provider. You would need to contact the College of Dentistry regarding the services required for your treatment. If the treatment fits into the academic plan, you may qualify as a patient. Your health and dental insurance cards will be mailed to your home address directly from Wellmark and Delta Dental. Be sure to verify your residing address through employee self-service when completing your benefits enrollment. ID cards should be received 2 to 3 weeks following your completed online enrollment. Please note that all of your cards, including dependents, will have the policyholder's name on them. If you need additional cards, please wait until you receive your new ones. Once these have been received, you may request new cards through wellmark.com and deltadentalia.com. Some of you may know about flex spending accounts, or FSAs as they are commonly referred. These are programs regulated by the IRS that allow you to put money into an account on a pre-tax basis, then use the money for reimbursement to yourself for out-of-pocket costs for health-related expenses or dependent care or child care expenses. Participation in the FSA program is completely optional. There are 2 ways to participate. The first is through payroll deductions. This is when you have money deducted from your paycheck on a pre-tax basis to be deposited into a flex spending account. The second way to participate is by defaulted unused credits. If you have credits remaining after you have made your benefit selections, the remaining credits will automatically default to a healthcare spending account. Our FSA program is regulated by the IRS. We provide a list of the most common eligible expenses for healthcare and dependent care on our website. Our plan is a use it or lose it program. You must use all funds in the account by the end of the plan year or funds will be forfeited. The plan year runs from January 1 to December 31, and all claims for the plan year need to be submitted to university benefits by April 30 of the following year. In order to receive reimbursements, you must have a direct deposit set up in employee self-service. For more detailed information on our FSA plan, please review page 14 in our guide or visit the website. There are two types of FSA plans: healthcare spending account and dependent care spending account. A healthcare spending account is for those expenses related to your health, including medical, dental, and vision expenses. For 2020, you may pledge up to $2,700 to your healthcare FSA. Examples of what you could submit for reimbursement would be copays, coinsurance payments, deductible payments, or prescriptions including eyeglasses, contacts, and medications. You can submit claims for eligible expenses for you and any of your IRS eligible dependents. A dependent care spending account is for those expenses incurred for child care while you and/or your spouse are working, looking for work, or attending school. You can pledge up to $5,000 per year per household in a dependent care spending account. The types of expenses are commonly known as daycare at a home or a center, a nanny, before and after school expenses, or preschool. You may submit claims for expenses for dependents up to the age of 13 or an IRS dependent who is physically or mentally incapable of self-care. Now we will go over benefit offerings including life insurance, long-term disability, and workers' compensation. Your participation in the group life insurance plan is required. The university provides coverage to eligible employees at 2 times their salary at no cost. This group plan is a term life insurance policy with a maximum payout of $400,000, and you can convert the plan if you terminate or retire from the university. This plan is not age rated. You will have 4 options of coverage to choose from. If your salary is greater than $25,000, you could choose $50,000 in coverage and receive a $40 shared savings credit. The default option is 2 times your salary and is free to all eligible employees. You may also choose 2.5 or 3 times your salary. You can find further information on page 15 of your guide. Voluntary term life insurance is an optional benefit that employees may also sign up for during enrollment. This plan can be purchased to complement any group life insurance option. You can select from a variety of coverage amounts. Maximum coverage is $1 million. The rates are age rated and will change as the employee reaches ages 40, 50, and 60. We do need to disclose that according to the IRS, life insurance has a taxable value. The IRS has determined if an employer allows access to life insurance in excess of $50,000, the amount in excess of $50,000 has a taxable value to the employee. The taxable amount is added to your W-2. Taxes are not deducted from each paycheck. Voluntary term life insurance for spouses and/or dependents is also available. In order to participate, you must elect or already have coverage for yourself under the voluntary term life insurance benefit. Your dependent's benefit amount cannot exceed 100% of your own benefit amount. For example, if your salary is $40,000 and you elect 1/2 times your salary in voluntary term life for yourself, you must elect 20,000 or less for your spouse. You may cover dependent children starting at age 14 days to the end of the year that they turn 26. More information can be found on page 15 in the guidebook. Long-term disability is the second mandatory insurance benefit the university offers at no cost to the employee. You are automatically enrolled and will not have to make any selections during the enrollment process. Long-term disability provides 60% salary replacement for up to 2 years for employees who become disabled while they are actively employed. There is a 90 working day waiting period before payments begin. The maximum benefit is $300,000 per year. There is a 12-month period for pre-existing conditions. Accidental death and dismemberment insurance is another optional benefit that you may elect during enrollment. This insurance covers in the case of death or dismemberment by accident. Policies begin at $100,000 and go up to $1 million in $100,000 increments. You may select a plan for just you and your children, you and your spouse, or the family. Dependent children are covered at 20% of the policy up to $100,000. If you will be double spouse, only one of you can elect AD&D coverage. An individual and dependents may only be included once under this policy. Workers' compensation is a form of insurance provided to employees by the university. Approved claims for job-related injuries and illness entitle an injured employee to medical coverage related to the injuries at no cost and a portion of his or her salary for work absences. If you are injured on the job, you will first report your injury to your supervisor within 24 hours and then complete the first report of injury form that can be found in your employee self-service site. If medical attention is needed, please visit UI Occupational Health on Holiday Road in Coralville, Iowa. Retirement plans. Your retirement plan is another mandatory benefit as a benefit-eligible employee. Page 18 in your benefits guide has more information on the plans offered. You will have 60 days from your date of hire to make your retirement plan election in employee self-service. The decision you make will be the plan you are in for the duration of your employment. It is an irrevocable decision. It cannot be changed without termination of your employment for at least 31 days. We ask that you please research the different options to make the best informed decision for you and your family. There are two companies from which to choose your retirement plan. Iowa Public Employees Retirement System, or IPERS, is a defined benefit plan or an IRS 401A. Retirement income is based on a formula of years of eligible service and the salary earned during employment. More information is available on their website. Teachers Insurance and Annuity Association, or TIAA, is a defined contribution plan or an IRS 403B. Retirement income is contingent on the returns from individually elected investments. More information is also found on their website. Both plans are very good retirement plans. You should pick the one that is best for your situation. Contributions to the retirement plans are made by both the employee and the university. For TIAA, there is a formula for contributions. Your contribution to TIAA is 3.33% on your first $4,800 of salary you earn each year for your first 5 years of employment. Once your pay exceeds $4,800, your contribution will increase to 5%. The university contribution is 6.66% on the first $4,800 and 10% on all salary beyond that. After 5 years, the contributions will always be 5% and 10%. For IPERS, the contributions are always 6.29% from the employee and 9.44% from the university. For those in law enforcement, those rates are 6.81% from the employee and 10.21% from the university. Mandatory contributions cannot be increased or reduced. You are required to contribute the applicable percentage based on the plan you choose to enroll in. It is strongly recommended that you make an informed decision when selecting your retirement plan. The websites and phone numbers for both companies are in the guide. Additional information about the plans can be found on their respective websites. You will need to select a retirement plan through employee self-service within 60 days of your employment eligibility date. You will need to complete the enrollment beneficiary designation through either IPER's or TIAA's website. Employees whose wages are subject to tax withholding have the option to make additional pre-tax or after-tax contributions into a 403(b) voluntary retirement savings plan with 6 different vendors to choose from, or the 457(b) deferred comp retirement savings plan through TIAA. Both of these plans are voluntary, and you will enroll in one or both if you wish to in employee self-service. Voluntary insurance options and employee discount programs are just a few benefit offerings that our employees can take advantage of as a regular benefit eligible employee. Voluntary insurance plans are not administered by the university. Information for these plans can be found on page 19 in your guide. These plans are offered and administered by outside vendors who partner with the university to offer these plans to our employees. Some examples are vision insurance, long-term care, critical illness or cancer insurance, auto insurance, and short-term disability. The most popular voluntary insurance plan is the vision insurance. This plan is offered and administered by Two Rivers Insurance Services. Enrollment for the vision plan must occur within 30 days of employment, eligibility date, or during their open enrollment each year that runs from January 1 to February 28th for an April 1st effective date. This is your annual opportunity to enroll, make changes, or cancel coverage. One of the most utilized employee discounts is through the UI Optical Department. They offer a discount to UI employees on services such as glasses and LASIK type surgeries. In addition to the dental benefits, the Delta Dental Insurance Plan also includes Delta Vision. This is a discount program for vision care to those covered by the Dental 2 plan. It can be used for discounts at participating providers for eyeglasses, contacts, LASIK procedures, and eye exams. You can locate a provider through deltadentalia.com. The Employee Discount Program monitored by the Benefits Office highlights discounts offered by various vendors to UI employees. Information can be found on the University Benefits website listed on this slide. These are discounts offered by vendors. This list is always changing as companies contact our office to offer a discount to our employees. This list is not all-inclusive. There may be companies who give a discount that we don't know about. I always tell employees it never hurts to ask. We will now touch briefly on time off, including vacation, sick leave, and holidays. More information can be found on page 20 and 21 in the guide. Vacation accruals are prorated based on your percent of appointment. Academic year faculty members do not accrue vacation. The balance of your vacation may not exceed twice the current annual rate of accrual. Once the max is reached, you will not continue to accrue time. You won't lose time, but you will not accrue time until you are below the maximum level again. If you reach your maximum accrual and do not have a vacation planned, you can donate time to the Catastrophic Leave Program. Information about that can be found on the benefits website. Vacation accruals can be seen here and found on page 20 in your guide. As you can see, there are different accruals based on the position held due to the contract differences. Information about sick leave can be found on page 21 of your guide. Accrual rates enlisted are based on a 40-hour work week. Eligible employees accrue 12 hours each month. with that amount prorated based on the percent of the appointment. There is an option to convert your sick leave to vacation. All eligible employees who have accumulated a minimum of 240 hours in their sick leave account and did not use sick leave for a full calendar month may elect to convert 12 hours of their sick time into 4 hours of vacation. The university observes 9 holidays each year. The actual date of the observed holiday may vary depending on your department. For example, in the benefits department, if the 4th of July falls on a weekend, we will have either Friday or Monday as the holiday. Those departments that have employees who do not work the traditional work week may have the actual day as the holiday. You should inquire about holidays with your supervisor or HR rep. Another great benefit that eligible employees have access to is the health and well-being programs here at the university. Page 22 through 23 of your guide will walk you through many of what is offered. Well-being is a state of optimal health, happiness, and purpose. When assessing health and wellness, it is common to focus on physical health or fitness. However, whole person well-being takes into account things like financial well-being, stressors in the work environment, family and relationships, emotional well-being, and resilience. Things that you often can't see, but it also can have a huge impact on your energy or your mood. The departments of Live Well, Family Services, and UI Employee Assistance Program have a host of free resources, programs, and tools that can all be found at the Employee Wellbeing website listed here. To get started on your Live Well journey, take about 10 minutes of your time to complete your personal health assessment, meet with a health coach, and sign up for your recreational membership. UI Family Services offers important resources to employees to help them be successful in their professional, academic, and personal lives through things like workplace flexibility, elder and child caregiving resources, as well as new parent resources like finding lactation rooms on campus. In today's fast-paced world, managing the competing demands of work and family life is more challenging than ever. The Employee Assistance Program, EAP, provides services to faculty, staff, and their family members to promote emotional well-being and to increase engagement and productivity. Find more information on these programs on their website listed here or in our benefits guide on pages 22 and 23. Your next step after reviewing all of our benefits is to begin your benefit enrollment process. You will complete your enrollment electronically through employee self-service. You must complete it within 30 days of your employment eligibility date. You will make elections for health, dental, group life insurance, voluntary term life insurance, accidental death and dismemberment, spouse and dependent life insurance, and flexible spending accounts. Step-by-step instructions can be found on pages 24 and 25 of your benefits guide. During the benefit enrollment process, you will enter your beneficiaries. You must have at least one beneficiary for your group life insurance plan. Please note there is a difference between a beneficiary and a dependent. A beneficiary is anyone you choose to leave your life insurance money to in the event of your death. This could include your parents, your siblings, friends, your church, etc. Anyone who is a dependent can also be a beneficiary, but not all beneficiaries can be dependents. You can name primary and contingent beneficiaries, and you can have more than one of each. A primary beneficiary gets the insurance money in case of your death. A contingent beneficiary or beneficiaries, if you have more than one, would get the insurance money in the event of your death and the death of your primary beneficiary. You can make changes to your beneficiaries during the year through employee self-service. Please note, Submitting your beneficiaries with the UI Benefits Office does not name them for your retirement account. You will need to contact TIAA or IPERS to establish a beneficiary through those programs. When you are ready to enroll, you can sign in to Employee Self-Service with your Hawk ID and password. Once you come to the main screen, you're going to want to select the Benefits and Wellness tile. On the next screen, you will select the Benefits Enrollment tile. You should now see this screen with a higher enrollment event to be worked. It should state Open, Edit Your Benefit Elections. Select this link and it will take you to the next screen. This is where you will add your beneficiaries for your life insurance and where you will add your dependents, if you have any. After you have read the text, and you will want to select the blue button on the right called I agree, view and update dependents and beneficiaries, you will need names, date of birth, and relationship to you for beneficiaries, and for dependents, you will also need this information plus their social security number. Once finished with this step, you come back to this screen again and will then need to select the button on the left to begin making your elections. Once you have made selections and added dependents to coverage and beneficiaries to life insurance, you will see three buttons at the bottom of the screen: Recalculate, Keep for Later, and Finish Enrollment. Recalculate will calculate the cost of the options selected. You will be taken back to the top of the page and you will see an account overview which will show you the credits and charges for the selections that you had made to that point. You may choose the Recalculate button as many times as you need. Keep for Later will save the selections you have made at that point and allow you to complete the enrollment later. You must go back in to complete your enrollment before your 30-day deadline. When you keep for later, the system will not submit those changes for you. Finish Enrollment will calculate your selections and provide an account overview. It is recommended that you scroll down through your selections one last time to be sure they are correct before moving on. Once you have finished your enrollment, the system will bring you to one last screen that says Continue Finish Enrollment. This button will actually submit your selections to the benefits office. Again, all of these steps are outlined in the back of your benefits guide. Once you have submitted your enrollment, you will receive an email notification that you have a confirmation statement ready to view in Employee Self-Service. This usually arrives typically 24 to 48 hours after you submit your enrollment. The confirmation statement will summarize your enrollment selections. Please review this confirmation statement carefully. If everything looks good, you do not have to do anything further. If something is incorrect, you should request changes and submit the changes through Employee Self-Service. Changes are allowed for 1 week from the release date noted on the confirmation statement. Last but not least, we are going to quickly talk about making changes outside of your new hire enrollment period and recap our enrollment deadlines. If it is outside of your new hire enrollment period, the only other time you are able to make changes to your enrollment selections is either during annual open enrollment period every fall, or if you have a qualifying event. A qualifying event can be birth or adoption, death of a spouse, marriage or divorce, loss or gain of coverage, a dependent child over 26 who is no longer in school, etc. If you have one of these qualifying events, you will have 30 days or 60 days of birth or adoption from the date of the event to notify the benefits office by submitting a benefits change request through your employee self-service. If approved, you will receive an email once your change event is ready to work in employee self-service. One last plug for the enrollment deadlines, as these are very important to remember. You have 30 days from your eligibility date or hire date to complete your new hire event in employee self-service. You will have 30 days from the date of your qualifying event to submit a benefits change request. You'll have 60 days if it's adoption or birth. Selection of your retirement plan must be completed within 60 days of your employment eligibility date. If you do not choose a plan, your election will default to IPERS, and you will not be able to change it to anything else. This concludes our benefits overview. We encourage you to use the benefits website and the benefits guide, as many answers may be found there easily. If you still have questions, you may contact the benefits office by email or phone listed here on the slide. Congratulations on your new position with the University of Iowa.